Hello everyone, I am Dr. Queen Aditya, Senior Consultant Gynaecologist at Papilio Clinic, Kolkata. Second trimester is from the 13th to the 28th week. Now, certain things are done and are recommended by the gynecologist in this phase. As I already mentioned, late first trimester or early second trimester, we do the dual marker along with the NT&B scan, which I had already mentioned. So that is, it's ensured that by the 13th week that is done. After this, after 16 weeks, that is between 16 and 36 weeks, the 2 doses of tetanus are given. That is also part of the second trimester. Now, roughly at around the 18 to 20 weeks, anomaly scan is advised to see the entire anatomy of the baby to rule out any gross congenital malformations. And this will be much reassuring both to the patient as well as to the doctor. Now, the medication like iron, calcium, folic acid, these are already going on. Folic acid is already going on, and iron and calcium are usually added in this phase along with protein supplements. And after this, any other medication as per requirement, that is for thyroid or hypertension or diabetes, these are also added or continued as per requirement. Then after this, roughly around the 22nd to 24th week, an OGTT is advised. This is an oral glucose tolerance test. This is to detect women who get diabetic in pregnancy. This is called gestational diabetes, which is peculiar to pregnancy and usually becomes apparent only around this time. So a woman who has during the earlier phase, during first trimester, who has not tested positive for diabetes might become positive later, and this is a test that we cannot afford to miss. So this is also done, and since we are doing it, along with it some other tests are also repeated like hemoglobin, urine routine, and also if the patient is on thyroid medication, then a repeat of the TSH. These are also done at this phase, and the usual medication that I have already mentioned is continued, and the dosage might be changed, like in cases of antihypertensive or anti-diabetics after regular screening. The changes that occur during the second trimester are also to be noted. Gradually you can see the baby bump, which comes only in the second trimester. First trimester we can't see anything, and along with it there are certain stretch marks, the lower abdomen, and there's a line between the navel to the pubic bone, which is called the linea nigra, which it's a dark blackish kind of a line, and a lot of women come up to us and say, "Doctor, what is happening to my body?" And this is nothing to be scared of, because after delivery in some time it will also go off. And then otherwise the nausea and vomiting, which is so common in the first trimester of pregnancy, will gradually wear off, and you will feel much better. The complications of pregnancy also go down, because the possibility of a miscarriage and all are usually on the lower side. Hence your mobility and is not restricted, and you can go about more freely, and there is also no contraindication to having a normal physical relationship with your partner.